Okay, welcome to our online course for Part 4. This is NBS, and I'm Dr. James, and I'll be your host for several hours. Now remember, the great thing about doing our online courses is that they're available 24/7. Unlike some programs that are out there that maybe you have to blog in at certain hours or times, everything is here for you. We've been teaching so long, and I've taught more Part 4s than anybody in the world. I already know the questions you're going to ask, the concerns, the frequent mistakes. So we'll go through all that together, and hopefully this intro gets you off on the right foot, that you understand, yep, they've been doing it a long time. So first things first, 24/7, so get your pajamas ready because you can do this review anytime, any place, anywhere you want. Now, the next thing that I want to talk to you about is that this course includes, make sure you've got all your ingredients now, 2 note packets. So there's a X-ray note packet and a clinical note packet. So you want to get both of those printed off. They're great note packets. They've got lots of notes in them, but I'm going to tell you, we're going to explain them to you, show you how to practice with them, because there's a lot of do's and don'ts in this particular testing situation. Now, we are also going to give you an explanation of the test. We're going to talk about, all of the clinical things and X-ray things around this, all the orthoneuros. We will be quizzing you throughout this program. We have a hands-on practice opportunity that shows up here and there. We'll do case history, some orthoneuros. So in that situation, if you have a partner you're practicing with, it'll be great. Otherwise, you can use a family member or a doll. We'll kind of talk about some options and good ways to do that. We also have some special testing situations that we have now named them CPRs, like lifesavers, okay? So there's CPRs, and they're called clinical performance rehearsals. They're all 25 stations so that you can practice, and then practice your post-encounter probe, which is where patient encounter probe, where you after the patient, you have to decide what it is that you've collected, the data and stuff. So much to be explained yet, but you get the idea that we've got a very thorough course, and we'll take care of you. Now, as much as I understand the Part 4 test, Dr. Laura understands our computers and our programming and our tech services, so I'm going to have her explain this to you.
Okay, thank you, Dr. James. Our NBS program, of course, is online. It's been designed to be very compatible with most of your computers. If you have a PC or Mac, you need sound support, virus and malware free. You need to have an antivirus that's active. Internet Explorer, we would like version 9 or better. Google Chrome and Firefox. Your Mac OS SC, make sure you have Lion or better. Videos require flash running or browser with HTML5 support. Most of your portable phones and tablets should work. However, remember, you are limited to 2 devices for each of our online courses. And if you have any computer problems at all, you need to contact our tech experts. It's support@techexperts.us. Their website is http://www.techexperts.us, and they will do their very best to get back to you within usually a couple of days, if not sooner. If you have a virus or malware or something configuration that's causing your problems, they can offer to help. There might be an additional fee, but they're really good people. They are our partners, and they will be happy to help you, and they want you to be successful as well.
All right, now we're going to go through an explanation of the test itself so you sort of see where we're going. My grandpa always said, tell them what you're going to tell them, then tell them what you told them. So this is I'm going to tell you what I'm going to tell you, okay? This is that part. So before we get into the program proper, on page 1, if you've printed out your clinical notes now, that'll be helpful. On page 1, we've done an overview of the test, and you'll see that just about everything I'm going to say here is already written down for you, but let's go over it a little bit together. So your first day is X-ray. So everybody should know there's 2 days of testing. There's an X-ray day and there's a clinical day. On your first day of testing, it is diagnostic imaging. Now we nickname and call it X-ray, but an MRI is CT. Some other forms of imaging studies have been known to show up. So we will talk about all of that. There is a total of 10 stations. There are 2 questions at every station. Okay, there are 10 choices for each question, and you are going to select 2 of the best answers for each question. So a total of 4 answers per station, and you have 4 minutes to get that done. Okay, so that would be a total of 40 minutes. That test would be 40 minutes long. Now, each station then can have 1 or more images. The more images there are, probably the less likely you need to be looking at all of the images, but understand in total, is it multiple sites in the body? Were they motion studies? There'll be some motive for taking that many that probably is more important than reading the X-rays. Now, when the X-ray test or when we go over the information for the X-ray test, they've kind of outlined the areas that they're going to test you on, and we've kind of condensed them down here at NBS to basically, it really boils down to normal radiology, congenital anomalies, skeletal curves, and that can be scoliosis, that can be kyphosis, that can be a dowager hump, that can be, is it a normal curve, which is the toughest of them all. Stenosis can be canal stenosis, IVF encroachment, spondylolisthesis is a favorite one of theirs, trauma, fractures, dislocation, AC separations, arthritides, you know how many of those there are, tumors and tumor-like, which is probably the one that scares most of you, and you do too much tumor studying, so we'll try to get all that in check. But vascular disorders, hematological and vascular disorders, kind of a loose subject area, because sometimes even lytic Mets, because it's spreading through the blood system, can show up under this one, but then again it can be a tumor one. So this one probably varies the most about what's in it, because an AVN is often post-trauma, but then it can be vascular as well, so you can see how an awful lot of things might fit there. And then of course bone infections. So now what do you have to be able to do? Well, as a candidate, you've got to be able to recognize and diagnose. Now that is probably one of your best things. Somebody puts up a film, you go, oh, it's Paget's. They put up a film, oh, you go, it's fibrous dysplasia. That's probably one of your best things. But then when we the rubber hits the road is when we ask you to identify the radiographic findings and know the descriptive features or terms that are allowed and all the AKAs that go with that. So realize, like with this, you can't call it a syndesmophyte. Even if it looks exactly like a syndesmophyte, you still can't call it that. So we've got to kind of learn when we can use certain terms and when we can't. I would kind of double-star this one because that's probably an inherent weakness with some of you. Another weakness is understanding chiropractic procedures. That you're pretty good at, but the management every once in a while you're not good at, because a chiropractor, when they're managing a case, has to know when it goes to the medical doctor, what basically are they going to do for it, what are the risks entailed. So sometimes when we say this chiropractic management, we think, oh, that's only what I do. No, not exactly. You have to know what it's sent out for, what they're going to do, when, at what point do you take it back, when is it healed. So there's a lot more things to know to be savvy at that than sometimes you understand. So we've got a little catch-up to do there. And then another one is knowing the likely complications of the case. Is it likely it could turn into infection? Could it throw a clot? Is it malignancy? Those kinds of things. Okay, now day 2. Day 2 is your clinical and setup day, but there are 25 stations. And if you look at page 2, now let's kind of look as Dr. Laura brings this up. If you're looking at this in your large PDF printed off notes there, if you look at page 2, that gives the outline of the clinical test. And if you'll notice, there are 25 stations. Okay, that's what it says, 25 stations. And you're going to get 5 minutes in a station and then 90 seconds in the hall. Then 5 minutes in a station, 90 seconds in a hall. 5 minute, 90. 5 minute, 90. 5 minute, 90. So this goes on for a long time. It's almost a 3-hour test by the time you line up in the beginning, take your entire exam, and then kind of line up at the end, and they collect all of the things from you they need. So it's a 3-hour tour, if some of you remember Gilligan's Isle. So we don't want you to get lost in this maze. Now this is the setup. You may start at station 8 or 2 or 5 or 19 or 23 because everybody's going to be at a different station, but you are all going to move in this direction through the test, okay? So everybody is going to be, if you start in the setup stations, then you'll finish those, and then you're going to run around and do your case histories, and then your orthoneuros and your physical exam and so forth. Now here is something else I want you to understand about this test. The case history case that you may take care of. You may go into this room and in 5 minutes collect a case history. 90 seconds in the hall, you wait. Then you go into the next room that has maybe an x-ray, some labs, vitals. But based on the information that you collected from this patient, plus any additional information provided in this room, you have to answer 2 questions about that case. Then that case is over. And in some of your clinical and OSCE exams and things at school, you kind of proceed on with that patient. That patient's done on your Part 4 test. So that is a case. Then you move to the next case, and then the next case. So the case kind of come in 2-room pairs, okay? You perform on a patient, then you do a post-encounter probe, okay? Kind of afterwards, what do you think it is? So we call those PEP stations. So case history PEP, case history PEP, case history PEP. So you get 3 case histories, orthoneuro, post-encounter probe, right? PEP, orthoneuro, PEP, orthoneuro, PEP, orthoneuro, PEP, orthoneuro, PEP, orthoneuro, PEP. So you have 6 orthoneuros. You have 1 physical exam, which is usually about chest or belly situations. And then finally, 5 setups. So now we're looking, instead of page 2 in your note packet, back to page 1, and kind of saying what I said already, is that there are 10 clinical patients then. There are going to be 3 you perform case histories on, 6 orthoneuros, and 1 physical exam. These are people that you're going to be performing something on, and an examiner's watching. So 10 clinical patients, okay? The candidate will perform all the tests on a trained patient. There is no interaction done with the examiner. The only time you'll do something with the examiner is if you are instructed very clearly on the form that's posted outside the door and inside the room that you are to verbalize the finding of number 2 or number 4 of whatever you've been asked to do. Like, what's a positive Lockman? So you just kind of turn and say, you know, ACL, and then get back to work. So there's very little interaction with the examiner. They are not the way to get points on this test. Okay, the performance stations include, like I said, 3 case histories, a physical exam, and 6 orthoneuros. Okay, now a licensed doctor will be observing all this, and they're going to be scoring. When we talk about what they're scoring, they're not just scoring you doing a straight leg raiser perfectly. They're looking at psychosocial skills. How do you handle the patient? Do you help them up? Is there eye-to-eye contact? The clinical performance. Can you actually do the straight leg raiser? When they say, ow, what kind of data did you collect? What questions did you ask? What was your follow-up on that kind of thing? So realize that if you do everything perfectly, you've only gotten about 1/3 of the points right in that room. So we want to enlarge your possibility to get points, and of course then increase your score. So we'll be working on all of that, okay? We got a long way to go together, you and me. Now, when it comes to the post-encounter probe rooms, remember we said PEP, the PEP rooms. Okay, the PEP rooms, there's no patient, but each patient performance station is followed by a PEP room, okay? Followed by a PEP room, and that PEP room has additional info to help with what you've collected, what positive orthos or what case history information. In that PEP room, there are 2 questions with 10 choices. Now remember we said for X-ray 2 answers per question. This is 3 answers per question. Now the candidate must be able to diff-die. You've got to be able to tell what's the diagnosis and what were the close calls. You've got to understand the procedures, the testing, the management for the condition. Know the early methods to determine life-threatening or to rule those things out and detect them. And know likely complications for each case. So pretty similar to X-ray, but a little different. Okay, now there are 5 setups. We call them setups instead of adjusting because the last thing you want to do is put a force in there. So the setup stations in our posology stations, right, we're going to pose. Okay, 5 minutes, 90 seconds, just like everything else has been, so just a love note reminder there. But you're going to do 2 cervicals in one room, then 2 thoracic setups in another, then 2 lumbar, 2 on the pelvis or pelvic sacral, and then 2 extremities. So there is a total then of 10 setups, but there's 2 per room. So 2, 2, 2, 2, 2, 5 rooms. Okay, an examiner's watching you, set up on a patient. There's nothing else to ask the patient. The only thing you need to verbalize is your line of drive. The one thing I didn't say, and it's probably important to calm you down, is that they're not going to tell you just it's a PLI-M or L4 or something. They don't do that. They are going to give you the listing description. And they will do it both in static and motion. So where the spinous is and where the body can't go, or they will give you plenty of explanation. Then they're going to say, hey, we want the patient seated or prone or supine. Then they're even going to say, and we want you to contact their mammillary or their spinous or their Lamped junction or their lunate. So they're going to tell you what the patient is supposed to be doing and what you're supposed to be touching on them, and they're even going to tell you what part of you has to touch them. They want your pisiform on their, you know, whatever, okay? I don't know, fibula. We'll just pick a bone, okay? Now don't get worked up. I don't know that you have to put your pisiform on a fibula. Now again, by now, you've probably printed off your PDF note packets, but remember there's 2, count them, 2 of them. But these are great note packets. They've proved the test of time. But what we've learned is people that just read them don't do near as well on the test unless we explain them and practice with you and do some of these exercises that we have for you. We have really beefed up people's score, and you don't want just a 375 on this. Remember, some states want a higher score. We've got other insurance companies and sports clubs and stuff that are kind of making you now compete with each other based on your scores. You get more opportunities. So we absolutely want you to be successful and get the highest score you possibly can. So what you can do with our course that you can't do with other courses is you can rewind it, listen to the same thing again. So if you want to do that, go ahead, because we have, you know, if our course is like 25 hours long, then we always add about 10 extra hours. So we give you additional hours. I don't know exactly how long this is. I'm not the tech expert. But the point is there are additional hours built in so you can rewind. You can watch it again, right? Because we all have those moments when we go blip or say, hey, I need to do that again. So we also repeat information over and over. So when I know it's important, you know, I might say it 3 times or emphasize it or underline it or give a couple different examples. But the great thing about this is 24/7. I think that's one of the things that when we decided how to do this, we wanted it to be something that you could just sit down, do an hour of, 15 minutes of, 3 hours of. You kind of decide the intensity of your course. But please, turn all your outside influences off, you know. Get a babysitter, get in a separate room, turn your computer and phones off. Just get in there and get into this course and let it work for you, because it will pay off not just for this test, but for your entire future. You're going to use these 2 books you printed out forever. Okay? Now when it comes to grading, a lot of people think that it's just your performance, that you have to do 5 orthos and do them really well, and if you did, you get about 1/3 of your points right. Remember, we just talked about there's psychosocial, there's the mechanical, but there's data collection. So I always call that the valedictorian syndrome. My nickname for the valedictorian syndrome is that you go in and you do everything perfectly, and then 6 weeks later you get a score that really is depressing. Okay, so it's happened over and over to really good students, valedictorians included, and I know one, okay, that it happened to. So realize there's negative points. They can take away points you've earned if you're adding orthoneuros. So I'm going to talk about that with you. We're going to train you so your instincts are not to do that. If you add any physical exam procedures, if you add physical testing during the case history, if you try to touch that patient, that's quite disturbing to them, because that patient doesn't know what to think, how to answer, you know, they've not been trained for that. So just remember then what part of these rules are for is to protect the patient. But look at this one. If you have inappropriate boundaries, if you touch somebody inappropriately, if you do something that could be misunderstood, they can take away your entire room. You don't just lose some points, you lose a bunch of points. And really, if 3 different examiners say, you know, this person looks really suable, they look like they're a malpractice suit waiting to happen, they just fail you on the test. Doesn't matter how great you did on x-ray or setups or the rest of the clinical, it's gone. Okay, so how do we get positive points? Now let's turn it positive, okay? Okay, for patient observation. You can't just say, I noticed they have an intelligent, and say it mentally in your mind. You have to say it out loud. I see you're leaning. Why are you leaning like that? See, now the examiner knows that you noticed, that you know how to quiz the patient about it. You know, which leg is it running down? Did you hear a pop or a snap when it happened? Hey, do you have pain when you cough, sneeze, and bear down? Are those all the questions you'd ask if you walked into a room and saw a patient doing this? Or would you just do one of these? Okay, that ain't going to work. That's that valedictorian syndrome. So how do we get these patients? We're going to work on that. Preparing the patient, shoes off, socks off. You are not a shoe salesman. You do not flip people's flip-flops off. Flip. Okay, you don't do that kind of stuff. So we're going to talk about that. Patient instructions. Hold your breath. Breathe again. Shut your eyes. Open them. Some of you leave a patient blind. Some of you tell a patient to, traction breast tissue, and then this is just how they are for the rest of till you leave the room. You've got to tell them to relax. So we've got to work on some of your skills to make you mindful of how you can collect points in the room and how you treat people. Helping the patient. Help them from seated to standing to laying down, supine, whatever. Professional behavior. Did you wash your hands? Is there eye-to-eye contact? Did you call them by their surname? Or did you say, hey, Freddie, how are you today? And you're 20 and Freddie's 60. Okay, so we're going to watch for some of those behaviors and talk about how to really look professional, get all the points in that room. If you ever remember way back, the game Mario, right? Video, it's probably a video game that I know you know of because of you're probably watching old time stuff on TV and stuff, but Mario, you walked into a room, and there's probably games like this now even, so relate it to something that you know, and you had to get points to get out of this room. And you look under here, and you open the closet, and you look behind this, and you look under the bed, and ding, 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 all of a sudden there are points. This room is like Mario, okay? You walk in there, and there's points for all kinds of things besides just performing. So I want to get you the most points that we can in each and every room and situation. Now, as I said before, if you remember for Part 1 and Part 2, 375 keeps you alive, there are a few Part 3 states where Part 3 has to be, I think, a 475. That's the highest, though. Okay, so 475 seems to be the grade that we want to get. So how about we shoot for a 500? We've had lots of NBS students get 600 and 700. You always inundate us with emails about, hey, I got a 650, hey, I got a 725. So you guys are just doing great out there, and I know we're giving you the tools to do great with, because we've even taught many doctors that have been out in the field for 20, 25, 30 years. They come back and go, I am not ready to take a test at all, and they go in and smoke this thing when they're trying to get reciprocity to another state or get into another state. So I want you to realize we're here to give you the tools that you need.